do we go to get to the agenda then? I've got view meeting details, meeting quick view.
Yeah, view meeting details. And that's it. So just hold it right there until we can.
Right.
Don't wait for her. Let's go.
Okay, I'd like to call this meeting to order. We'll call it 6:03. And we'll do roll call. I guess I'll do roll call.
Yeah.
Mr. Fields?
Here.
I'm here. Mrs. Robertson?
Here.
Mr. Flake?
Here.
Is there anybody else I have to call? Oh, Mr. Carson Flake's not here, and Mr. Miller is resigned. We'll be to that later. Okay, so that takes us to Pledge of Allegiance. Do we have a volunteer to lead us in the Pledge of Allegiance? Where's the flag? Thanks, Kathy.
Right behind there.
Pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Kathy. That brings us to, we have a volunteer for the invocation. I will. I'll do it. Our Father in heaven, we thank you for this opportunity we have of being here and of serving our community and our students and our school. We ask that thy Spirit might attend us, that we might be directed by thee in the things that we do and the decisions that we make. We thank thee for the freedom that we are afforded to live while we live in this country. And we ask that we might be able to maintain those freedoms and do those things that we need to help keep us free. And we thank you for this opportunity of helping our community and leading our students. And we say these things in Jesus Christ.
Amen.
Okay, that brings us to, do you want me to do the adoption of the agenda as well?
Yes, please.
So that brings us to adoption of the agenda. I'd like to make a motion that we approve the agenda for, is that where we're at, right? Yeah. Approve the agenda for August
11th.
board meeting, August 11th board meeting.
I'll second.
Need any discussion? Anything moved around?
Well, I don't know what it is, but I guess it's okay.
Yeah. If we have to move it around
There's
later,
a
we always
copy.
can.
Yeah, there's a copy. Okay.
Well, let's call for the vote. Myself, yes. Mrs. Robertson?
Yes.
Mr. Flake?
Yes.
Okay.
Steve, could you show them the new features on the software now for board books?
Sure, I'll be glad to. First of all, I just want to make sure you can hear me.
Yes.
Okay, and you can see the screen. You're looking at my computer screen with the board book screen.
No, we're looking at you.
You're what?
We're looking at you, not at your computer screen.
Okay, Jason, is there something you need to do?
Okay, he's got it now.
Okay, can you see my screen now?
Yes.
Okay, good. Let me just give you a quick overview, and I'll try to be quick about all of this. There are a lot of features here that I won't go into today. Plus, just to warn you, you might see some more menu options on my screen than you see on yours. That's just because I'm an assistant administrator with regard to Board Book Premier. So the first thing where I want to start is at the home screen. So when you first log in, this is the screen you see. And by the way, the link that you see on your iPad it's just a shortcut to a website. And so it's not actually an app, it's a website that we're looking at here. And if you wanted to look at it from another device, whether it's your phone or another computer, you can just go to boardbook.org and you know, there's a few more login steps than you would if you were going, you know, from the link. But you can also get to it that way. So when you log in, this is the first screen you see, and I'm going to expand my screen so you can see it easily. Okay, so we're looking at that upper left-hand corner of the screen. So the first thing you want to do is click on the particular meeting you want to look at. So in this case, the August 11th meeting. I'm going to click on that, and then you'll see a drop-down menu. So I probably have more things than you do, but the one you want to go to, it says View Meeting Details, Join Meeting, and that's kind of that join meeting is kind of how I remember which one to go to. Now, join meeting doesn't necessarily mean you're going to join a meeting in progress. I mean, it could mean that depending on how we have it set up, but don't be confused by that. So we're going to click on View Meeting Details, it's Join Meeting. I think, yeah, my computer's thinking. Okay, so the screen now is basically these two columns. The one on the left is the actual agenda itself. And it's just, keep in mind, you can scroll back and forth through the agenda. It's sort of a truncated version, so it doesn't have all the, you know, the descriptors or anything like that here. So it's a little quicker and easier to navigate. And so when you're reviewing the board backup at home, you can do it the same way that you do it in a meeting. And when you're in the meeting, same thing. All you have to do is go over here and find the agenda item that we're on and click on it. So let's look quickly at minutes, item 1F. So when we click on that, see now you'll see on the center part of the screen, and I'm going to zoom it in a little bit. So there we go. You'll see that particular agenda item and all the pieces of information associated with that agenda item. So you'll see a description, and the description, by the way, appears on the posted agenda as well, so that the public has a good idea, at least a little bit better idea of what it is that the board is considering and what you may be voting on. And so the agenda item is minutes of regular meeting. Then under that, you'll see minutes of the regular board meeting held on July 24th, etc. And then here's the recommended action. And this doesn't mean that that's how you have to vote. It's just a tool to help the board president or whoever's leading the meeting to kind of help prompt them as to what needs to happen when the motion is taken. It can certainly be a different motion than what we show here. The next thing you'll see down here in this particular item is an attachment. So if you want to view that attachment in case the minutes of the meeting, you click on that. Now there's two different links there. One of them says download original file. I don't advise that. That's if you wanted to actually manipulate the file itself and do some things with it or update it or whatever. What you'll want to use is this one link right here, minute, where it has the top one there. So when you click it, it'll open a new tab in place of that agenda detail. Now, it's kind of slow, but it's coming. So while that's loading up, let me just show you. You'll see here now there's two different tabs up here. Now we can flip back and forth between the agenda item or the attachment that you just loaded. And so now we're seeing the agenda itself. Now, if you want to see it a little bit bigger, especially if you're looking at it on a small device, you can click over here on these three buttons, these little ellipsis buttons. It's the menu. You click on there, get a drop-down menu, and then you click on full screen. And now it's bigger. You can see it'll fill your whole screen. It'll come into better focus.
Steve?
So that's a good way. Yes.
Let's see if they have any questions now. That was good. I think I'm watching them pick it up, so I think they've got it pretty quick here.
Okay, good.
Do you have?
Then I'll click over here. Let me exit the full screen.
I'm good. You guys need any more?
I'm good.
We're good.
Yeah.
Steve, I tell you what,
Okay.
let's go for it.
I-
And
Okay, let me just show you a couple more things because it's important for this particular meeting. Okay, I'm going to close that. Now there's some other agenda items down here that have different kinds of information, and one of them here is upcoming meetings and events. So in upcoming meetings and events, there's two things: the next regular board meeting and the ASB 44th Annual Law Conference. Now, most board members want to know what's on the agenda before you decide whether or not you want to register. And by the way, this is all going to be online. You don't have to go to the Valley. It's all online. But if you want to look at that ASB Law Conference agenda, you'll see down here links with that little sign. You can click on that link, and there's a couple of other agenda items, by the way, that have links. If you wanted to follow them and look at the data, that'll take you right to the ASB website. You can look at each of the sessions here and see if that's really something you want to attend, and then you let Kathy know and she'll register you. So that's it in a nutshell, and I'll be done unless you have questions for me.
all right, maybe just hold tight, and we'll see if questions pop up, and Jason will also help us, I know. So thank you very much. The new features I think are going to help. So I think we're on my report still, Mr. Larson.
Actually, we have to do
the minutes.
from July 14th.
Okay, then I'll let you do that.
So I'll make a motion that we approve the minutes of the regular meeting for July 14th, 2020.
I'll second it.
Need any discussion or any changes on that? I'll give us some time because I know I haven't gone through it very well. Any questions? Okay. Call for the vote. Myself, yes. Rhonda?
Yes.
Dayton?
Yes.
Okay, so that passes. Now that gets us to reports. Mr. Fields, you're up first.
Yeah, so you have a written report from me, and there's a lot going on. So if you have questions up front, just let me know, and I'll cut right to the questions. But everything that's attached to my report is on our website. We're making sure, or I'm trying to make sure, that we're in total compliance with what the state's requiring of us during the shutdown. So, like for example, as part of my report, as an attachment to it, is what they're calling our they title this our distance learning plan. So that's on here. And that was actually approved by the state for us. So you can see it lists the different, some of the curriculum and assessments that we use, and our plan for opening, taking attendance, all those things. Also attached to my report are some of the letters we've sent home, or the communication that we've sent home, a waiver that we have in place in case students want to come to school right now for the computer labs or to play football when and if that gets started. We are planning another community meeting, a virtual community meeting on Thursday evening that we're going to advertise at 5. So the principals and I will be involved in that, and we'll invite anyone to join us in the Google Meeting forum. And
So I know that the governor put a thing out that said you have to meet certain criteria to be able to go to school face to face again.
right.
I think there's 3 items. Can you give us
Yeah.
a basic of what those are?
Yeah.
Or am I
3
stepping on your toes?
No, that's fine. There's 3 categories, and it has to do with actually I can't recite them, but your percent that's been infected with the virus according to your population, and your percent that's tested positive out of the amount of tests that you've given is another one. Anyway, to cut to the, maybe someone else could, and we could pull it up easy. But we meet 2 out of the 3 categories. So they've divided into 3 categories, like you said. That is our county. But the third one is going to be a hard one to reach, according to the county health director. He was in our last community forum, a virtual meeting we had, and gave us some information on that. But our county, or our area code, zip code, is nowhere close to meeting that metric. So there's some complications that arise. That doesn't mean that we can't still try and open, but go ahead.
Okay, I'm confused. Is it totally by the county or
No.
just our zip code?
No, it's not by the county. They're technically saying it's still a local decision, but to sum it up, they're putting some pressure on us to make that decision for us. So, at least in my opinion. Okay.
How are they doing that? Are they saying they're going to pull funds? What are they doing?
Yeah, not directly pulling funds, but doing things like our insurance. There's some questions about coverage with the insurance. There are questions about what we would do in
Liability
case,
for the school
Yeah.
or what?
Yep, for the district. And then there are some questions about if somebody gets infected, are we going to have to clear out school or not? What's the process going to look like? Say we're testing kids, but we don't find a fever. A kid develops a fever or a symptom at 10 o'clock in the morning, but he or she's been in a classroom or in recess and potentially exposed the entire group. So are we going to be forced by the county to, empty out the school, or encouraged by the county or insurance say you need to do this? And then, so now we have the stress and anxiety that goes along with parents and students not knowing, are we going to school today or are we not going to school? When we open, I want to, within reason, make sure that we can stay open without having to shut down completely again and then leave everybody, in the lurch, trying to know if we're going to be open or not. I think by putting this off a little bit, we can have more assurance when we do open that we'll be able to stay open. Now, that is my opinion on and we can do what the board wants to. But I would encourage the board to consider pushing our start date off from August 17th to a time later where we know more. For example, the county health director told me that the governor is going to come out with an additional executive order this month or this week that said that provides what we need to do in case it's a suspected COVID exposure, like a student. We have to notify the CDC or we have to notify the county. Those orders are coming this week. They haven't come out yet, but if that is indeed the case, we should know that before opening, because if we don't know that, I think it's going to cause us problems. Again, now I'm giving you my opinion mixed with what I've heard here, so just so you know that. Pushing it off to me makes sense because we'll have more answers and we'll have some reasonable assurance that we won't have to empty out the school again. And I'm not sure we have that right now.
Approximately how long are you looking?
I'd like to call it indefinite until we were going to have some answers to provide if we open without following the guidelines set forth by the governor and the county. And we have to have good answers for those.
So basically right now, we're waiting on the 3rd.
Yeah.
To be able to open, following their guidelines, we would have to meet that 3rd criteria, whatever.
Yeah.
So
And it does not look good for that criteria. I do think there may be a school district or two looking at opening. I think they're going to have pressure to do some things with their masks that we weren't, last time we met, we weren't planning on forcing that issue. And I wonder what's going to happen with that. It's a big unknown.
So, what is the third one?
It looks to be that the percent that they test has to be lower than 7%.
That they test?
That'll test positive.
Yeah, that would test, so your positive percent is lower than 7.
And
But
is
of
there a
course-
specific one of these tests they're going to use? Because so far, I'm not convinced any of them are accurate.
Yeah, I can't answer that. The standard swab test, they're not using the DNA saliva one. That's not what they're using. They're using the regular swab in the nose.
Tickle your brain.
Yeah, but I think those numbers could be different depending on how many tests they're giving. So I don't have a clear understanding on that. But the percent tested has to be lower than 7 is that final thing that we're not meeting.
Do we
We're
know
over
where they're at?
15.
Are they at now? Do we know where they're at now?
Over 15.
Over 15?
It was right somewhere over there. Over that.
And we still don't have a clear
Yeah, sorry, go ahead.
number as to the children. It's my understanding there's only been 15 children die from this.
That's right.
And they all had underlying other problems.
Yeah, it could be. But some of the concerns when those things are said, I'm just giving the other side to this, that children would be the ones who pass it along. I've heard now if they're under 10, they don't. But that
I heard
hasn't
up to
been
12 they
confirmed.
don't have the right enzyme to do it.
Yeah, but that hasn't been confirmed. There's also concern that if they have that and the flu at the same time, it could be a new issue that they're not ready to deal with. And another issue that's been brought out is that it may stunt brain development, even though the virus doesn't attack them like it. And I don't know if this is true. I haven't been able to verify it. So is it real news, fake news? I don't know, but that there is some issues with adolescent brain development if you get this. So those are some of you can call them a fear tactic or whatever that's out there, but that's some of the things that are weighing heavy on me.
Well, I also understand that they're concerned about especially 2 to 6-year-olds not being around other children. Yeah. I mean, they need that interaction. That's how they develop their learning abilities, is being around other kids, and being isolated is affecting that.
So, back to the 7%, is that tested in a day, or tested in a week, or tested in a month, or tested in the last year?
What they said at the
Where's that percentage coming from?
What they said in the webinar is that number, I believe, is it's like the last 3 weeks that have been tested. So it's not I don't think it's the whole thing.
Of those tested, 7% tested positive, correct?
I think
We
so.
think so.
Less than 7. But you can look on, it's 9.9 for our
Jody
county.
has some information. Go ahead, Jody.
My husband works in the healthcare
Okay.
industry, and he said that 40% of those tests are false positives or false negatives, so they have a 40% fail rate.
Right. I didn't mean to interrupt the principals for that. Go ahead.
And so the third area also that you're asking, Mr. Larson, the third area is the percent of those that go to the hospital and are deemed they're there because of COVID-19. That's the third benchmark. There's the number per 100%, there's a number percent positive tested, and then the other one is how many go to the hospital. We meet the first and the third one. It's the second one that.
It's the second one. All right, I was just,
Well, another concern is the last test that we had on was
19.
19, so it's not up to date. date, so they don't put those tests up.
We don't know what's going on now.
Yeah,
We're
we don't.
relying on
They-
information from
They
clear
said
back
they
to the
would,
beginning of July.
they would report every
Right.
Thursday, so the data will probably be July 26th. Data will be this Thursday.
Yeah, I personally don't trust the data that much, but that's not what I'm basing my decision on. The support that we have in making this decision is what I'm basing my decision on, basically. Like, for example, even though that's 100% accurate what Eric said, they are telling us verbally the numbers have gotten better, that they're as good as they have ever been that they've seen through this shutdown.
They being
The county health director, and he like I've mentioned before, is willing to come to a board meeting if you would like to have him here. He's told me that more than once. Know that apparently the numbers are probably getting better, but they are pulling numbers from way back in July. There's some areas they're not doing any tracking, like statistics, other counties and stuff. So I think it, like Ms. Balda said over there, I think it's a lot of it's skewed, and I don't know what exactly to pull to make a good decision with the data they have available. That's what I'm saying. So
I don't personally like being held hostage, and I feel like we are, but we cannot move forward without insurance. That's all there is to it. That's not a choice.
we may be covered. They haven't said that we wouldn't be if we have some things in place, and that if we do certain things. And I do think we're in line to do those things, but it doesn't mean I think we should open on the 17th. I think some things could change. It does change daily on us. Last month I put out a letter, and the next day there was a executive order, and things changed from the letter I posted. It was not a good thing in my opinion, but it would be in question if we could. And this isn't an agenda item that we're on, but we will get to it. So I don't mind reporting on this right now. We are opening our camp. We are opening on a limited basis, just not our full instructional program. We're planning on the recommendation tonight. Mr. Miller's going to talk about it, but our sports, some of our clubs can meet within reason. We're doing some things with the pool within reason, with limiting numbers, trying to have proper signage, social distancing, mask, waiver. So we are going that direction. I think a transition time like that would be better than just opening cold. That's why I'm asking for what I am later on the agenda.
And I understand that the information changes every day, but as much information as, even though you send a thing out one day and then the next day the governor changes it, then you're like, oh man, our parents still need as much information as they can get, even if the governor then changes it, because I don't know, we have a lot of parents out there that are concerned, because I have been asked about this more than anything I've ever been asked about. What are you doing? When are you starting? What are you going to do? And if they get better answers from other places, or if they feel other places have the answers, then that's what they're going to do with their kids, take them other places.
Right. Well, you haven't, if you have heard complaints, please share them. But we haven't heard many complaints with how we're handling it so far, right, with the, having it in phases. So.
Yeah, no, I haven't heard any complaints. It's just the only complaint I've heard is they're not sure what our plan is, even though we try, but then they have to understand it changes daily as the governor says whatever he says. Right.
So after the meeting tonight is when I was going to get out some more information. I just want to make sure the board, we're in agreement, or we pass this resolution that I have. So, we can do other things to help with this transition. Right now, we're opening the lab 2 days for all or any students. We can extend that time frame, more hours. We can do some more on-campus things. But for the coverage, the waiver is required, basically required.
For the insurance.
Yeah. Or, yeah.
And by lab, you're talking computer lab?
Yeah, access to the internet and resources here. But we're being very responsive to people that need internet service out there with these hotspots and devices that we're sharing. So.
Well, I know today Rochelle had 8 kids trying to work on tablets and laptops, etc., and nobody could get anything done because her internet didn't support it.
Well, that might be a case where we have to expand the lab, and we want to make that decision on Friday. So in our attendance, I think this is another important piece of information for you guys to know. It looks like it's down about somewhere between 10 and 15%, our enrollment.
Compared to last
And the attendance combined, yes, compared to last year. So that would have an impact on our funding, definitely.
I also know that people who were in our school last year are homeschooling now.
Right. Yeah, that's included in this number. So we have lost some. Maybe they'll come back, maybe not. I don't know.
Well, I know a lot of that was just to the questioning of, well, if they do open and then that gets closed again. And so rather than, anyway, the parents that have talked to me that have gone that route, it's more of an issue. If I homeschool and they can get online and they can do like K through 12 or whatever, then they know what their kid is doing.
Yeah.
They don't have to worry about going to school, not going to school, going to school, not going to school.
Yeah. They don't have to risk being with other kids, but then the other part of that is also true. Yeah. They don't get the benefits of being with other kids and other adults. There's a benefit.
Well, but nobody's getting that now anyway.
Well, they are, because we're opening the labs. We're having clubs, sports, the pool, all kinds of things. We're going to try and offer as much as we can within the parameters allowed by the different authorities. And we want to expand it even more. But when we open, I'd like to make sure to answer that problem that is out there, that we're open for good, that we don't have to say, okay, elementary, you're home, but high school's not, or vice versa, because we had a potential case here. And is a potential case going to shut us down as much as a tested case? Because a lot of people get it and they don't even get tested. They just deal with it like they would the flu. See, how is that going to be defined in all of these protocols? Unanswered. And it can make a lot of people mad if we're sending them home, then letting them come back, sending them home. That's my fear. There's other things on my report, projects that we're involved with, from this roof to the parking lots, the roof at the high school. We also have a couple new roof projects in the works, the elementary main campus. Looks like that's been approved. They want to do extra structural evaluation in there, so we have to get into the ceiling in the elementary gym, which is 35 feet high and needs to be tested. So that's caused a slowdown a little bit, but we're dealing with it, and it's been actually scheduled now. So it should start next week, that part of the structural evaluation. If you look at the elementary roof close up there, just for your information, when they did work on it in the 80s and 90s, there's a couple different things they did. I know you guys will remember some of this, I'm sure, if you've been here. They wrapped it with a cable and cinched it up because it was sliding or moving. And they also put some structural bars across it, metal bars, to hold the glulam beams in place. And when they did that, I don't think they did anything to the top of the roof. So now the top of the roof is not equal, but there's been 2 layers of shingles, at least 2 layers of shingles that are up there. So it's kind of, we're dealing with uneven surface that may be a result of that, but that's just what it is. They want to make sure it's still intact completely before they start tearing into it. High school roof is also on there, and I think that has been approved for the SFB So we still need to approve parts of it, but that's in the works. Let me see. We had staff training lined out. A lot of it was done on the computer this year, more than in the past, but you can see the list I've provided. And I wanted to credit Mr. Hutchins for helping with the CPR training that he lined out. We've got all the supplies we think we need for masks and things like that for when we open. We are still waiting on some supplies. Okay. Other than that, if there's not any questions, I guess we can and take your time to review anything. But we'll move on to the next report.
Is there any question?
The next report is a hard copy. You guys should all have. The junior, senior high.
Good to move on to the next one.
I'm already at the elementary.
Oh,
Well, maybe I.
Thank you, Mr. Fields, and Mr.
Yeah.
Miller, you're up.
Yeah.
Sounds good. Well, just a couple of pieces of information to start off. Did a report on attendance. We've only had 2 days, but so far it's gone considerably well. Considering that it's just an online version. The kids are taking their own attendance by signing in, and then we follow up later in the day with a phone call and try to figure out what's going on. Today we were right about 90%, so that's good. One of the questions you guys brought up, I actually have in here, is how many kids have we lost due to COVID-related situations? We've lost 23 kids at the high school and junior high. 15 of those are normal withdrawals. A family moves out or transfers to Holbrook or something like that. And there were 8 that stated it had something to do with COVID. Usually it was, I have a family member who's at high risk or something like that, is what we've been told at the high school. So there's about 8 there. Enrollment at the junior high school is just about a student or 2 more than what it was last year. We got a big 6th grade class coming in, so that helped out a lot. But we're about 3 students higher in the high school and right about the same for junior high. So another thing, the AIA, which is our the Arizona Interscholastic Association, they've decided to push back the fall sports start dates and stagger them. And so we would already be in all of our sports right now, but the new dates: cross country starts on the 24th of August, volleyball on the 31st, football on the 7th.
And those are definite, or is that?
I don't know if there's any definites anymore.
Yeah.
Well, I
Right
wanted
now.
to know
Pretty
because it.
solid.
Right now, yes. And to my knowledge, it's not going to change. They seem pretty certain on it, but they've changed it once before, so I can't promise that.
Maybe tell them some of the precautions that were taken, or the
They put out by sports a list of recommendations on how to make it as safe as possible, and they include things like making sure you use social distancing as much as possible. Football, we're looking to get face shields that cover the the face mask area, and things like that, the typical things that we normally discuss with COVID. So
Very good.
one other thing I wanted to bring up. For years we've kind of, everybody that our school colors blue and gold. For years everybody just chooses a different shade and color of blue and gold, and so we're trying to kind of establish a set precedent what we're gonna use, and looking at possibly updating the logo, look very similar but just updated. So I do have pictures. I'll show you afterwards if you're interested, and you can kind of give your opinion on that.
Just so you know, I'm not trying to. we have had rules of, and some standards. It just seems like they change every time we get a new AD. So
exactly
the coaches might order navy blue one year and then get some turnover and personnel, and then before we know it, it's royal blue. But I appreciate them looking at this and trying to get some uniformity.
And hopefully we'll try to make everything consistent where, say, a team is going to order team shirts, they'll have a list of colors that we agree on that they can choose. So if you want to see the pictures and the colors afterwards, let me know.
Yeah.
That is all I have unless you have questions.
How's it going with your distance learning, you think, after 2 days? Are your teachers able to work with each other? What kind of time do you think your kids are spending on?
Tell them about the synchronous plan versus the other things.
So I start off has been a little rocky in some areas, but great in other areas. In general, Google Classroom is the that's the source. The way we're passing out the assignments, and the teachers have gotten fairly familiar with that, and I think they're doing a good job there. We have another program called School City that we use for testing that we've had problem after problem with, so that's been the struggle. We got it up and running for today, and then it worked for half the day, and then we had more problems. So anyways, that's been the biggest struggle. But overall, I think we've done a good job, especially considering I think we have 6 new teachers. So trying to get them learning the new program has been a challenge, but they've done a great job, bought in, and put the time in to figure it out. So far so good, and we'll get better as we go.
So this is a question that you probably don't know the answer to, but I've been asked it, so I'm asking you. So I know we put out kids should only be in front of a computer for however much time during the day. And I'm already hearing that isn't working out. But you can't choose how long it takes a kid to figure out. Some kids are really quick at it, some kids aren't. But so if we're going to be an extended period of time at this, has there been any thought to, hey, they have a class period anyway, they're supposed to be in class from 8 to 3:30. If you were signed up for English from this time to this time, you have English from this time to this time on the computer, you have whatever, so that you're following like a schedule. And is there any reason why we can't do that? And is that feasible that we just, we're paying our teachers to teach anyway, so why can't they teach a period? I'm just curious, because it seems like junior high and high school would be, the kids should be pretty computer illiterate to be able to follow that type of schedule. Have we thought of
And
that?
bring up that program you talked about earlier to me, that the plant has.
Oh, there's lots. I know we use Google because we have a lot of Google stuff. And I'm not real familiar with Google, so I don't know if it's capable of doing the same thing. But like, I work from home and I have meetings all the time, and we use Teams, which is a Microsoft thing. But you can have up to 50 plus people on a meeting, and people can ask questions and interact. They can see each other.
It's the same.
So you still have some interaction with the kids.
Google Meet is the name of the Google product, and same 200
Same
plus.
type of
You can have 200 plus in there, and they can all talk. The teacher has the ability, if they're the administrator for the meeting, they can mute people, I think. They have some control there. So as far as doing the synchronous classes, there will be more time if we go extended online learning, there will be more time than 2 hours a day for the junior high and high school, just because most of their assignments are going to be online. So there will be a little bit more time. We have talked about doing the synchronous thing, and the problem with doing
There's Jeff.
like they log in every period.
The hack or something. I don't know.
The problem with doing every period is we have some families that have 5 kids. Their internet can't support it. But if we do that, they're all going to have to be on at the same time. And so what we're looking to do is using our core classes, and I'm going to set up a new schedule where it's going to be reduced just to the core classes. So they'll have to sign in every day. I don't have the schedule completed, but it'll be like math will be Monday, Wednesdays, English will be Tuesday, Thursdays, and then science will be a couple days in there.
And will they still be doing the same amount of work as if they were in class?
It probably will be a little less overall, It'll be the same for the core classes roughly, but overall, I mean,
Because that's a concern a lot of parents have expressed to me, that their kids are not going to get enough education. That's why some of them are going to homeschooling.
For the
Because
core-
then, after this is all over, hopefully soon, then our children are going to be behind where they should be for their education.
I would disagree with that. But yeah, people
How
are
can you
entitled to their
disagree if
own.
they're not covering the same stuff?
Well, they're going no. So core classes are going to be the same idea, but if you look at a woodshop class, they're not going to be able to do the same time and teach the same thing. So
And
that's
it's
going to be the
yeah,
difference.
and they're not any use arguing in this either, because it's going to be different depending on who's doing the homeschooling and who's doing the education.
Well,
at
and I'm
school.
not talking about shop, I'm talking about the core classes.
So the core classes will be very similar. They have an hour a day is what I've told the teachers for homework roughly and assignments, which is what they do already. So
You can't get mad at us for thinking our programs are effective and our staffing and our resources are effective for what they do. But in some cases, if people choose to homeschool, we're not going to argue with that either. But are we offering a good quality program? Yeah, obviously he's going to feel like we are. Hey, if I could interrupt in your report here, we'll come back to it. But we had the county health director popped up here. I don't know. There, Jeff, can you hear me?
I can. Can you hear me?
Yes. Thank you for stopping in here to our meeting. We appreciate that, and we'll see if the governing board has any questions, or if you want to say anything off the bat here.
Oh, I just wanted to say real quick, thank you for the partnership. We've been meeting with school superintendents since early March, really preparing for this day where we had to make these hard decisions, and having the relationships built and the trust between the different organizations built. It's made, harder decisions less difficult, mainly because of the partnership. And really, I just wanted to be available for any questions that you had about the benchmarks, about the, what Navajo County looks like as far as cases, and any type of, any questions that you might have that are looming out there for COVID in the schools.
Yes, thank you. Yeah, they did have questions earlier, and I didn't do a good job answering.
Could we
them.
just get you to run over what the benchmarks are and what our area looks like as far as meeting them?
Yeah, so the three benchmarks, the first one is a decline in cases or less than 100 cases per 100,000 for 2 consecutive weeks. The second one is percent positivity, how many tests come back positive versus how many tests are taken. And then the third one is COVID-like illness surveillance. And COVID-like illness surveillance happens at emergency departments. When an individual presents, it's a questionnaire that participating hospitals use, and it's a good early indicator for us of what's going on in the community. As far as where we're at in Navajo County, we are meeting the benchmarks of 1 and 3. The benchmark that's hard for everybody to meet is the percent positivity. We're looking for a number of 7% or lower for 2 consecutive weeks. And right now we're sitting at 9.9%. One of the questions that gets asked to me a lot is, what does my specific town or city look like compared to the Navajo County average? So what we've done over the past couple weeks is gone back and look at a month at a time per city, per town, and apply the population to the same methodology for the overall average. And I was quite surprised at how close each one of our cities and towns looks almost exactly like the county average. We'll have days where maybe North County cities and towns are a little bit higher than South County and vice versa, but the overall average was surprisingly very close. And so using the average
or what's on the dashboard for Navajo County is a very good indicator of what's going on in the city or town per population.
Okay.
Did that answer your question?
Yeah, it
Yes.
did actually. Yes.
We have actually a board member in the audience here, but go ahead.
So my understanding is you have to hit that 7%, but out of those who are tested, aren't most of those who are tested think they already have it? So our testing is kind of skewed because we're not taking it.
So I'll rephrase that. So the concern is the percent set, unless you heard it.
Yeah, I heard it. So you're exactly right. That is a hard metrics to meet because we need to test more to keep that number low. We also know that by testing more, we're going to find more asymptomatic cases. So it's a tricky number to meet. And, it's a guideline. It's something to consider, but it's not a mandate. We have many school districts within our jurisdiction who are using this as a tool to help make their decision, but they're not using it as the guiding, the only tool that they're using. They're taking a lot of other things into consideration. So it is a tough one to meet. We do need to test more across Arizona and across the U.S. But hopefully with less invasive testing methods, being worked on and being tested, people will be more willing to take this test more than once. Because if you take this nasal swab once, you don't want to take it again. I guarantee it. It's not fun. It's not comfortable. So we need a less invasive testing method before we can really get those testing numbers up much higher.
So to be fair, Jeff, most of the people that take it already think they have it. But even people that have it may not want to get tested either. So you got on both sides there.
Definitely. There's with any disease or virus or infection, there's always a large percentage of people that don't get tested. And we didn't take any of that into account for these benchmarks. We wanted to go straight off the numbers and base the information off of that.
So this is kind of a to the side question, I guess. Is the nasal swab the only test results that they consider valid? Because, well, for example, I work at APS and we're required to get tested weekly, but we don't do a nasal swab. They were doing nasal swabs, but people were like, I ain't doing that anymore. So they're working with ASU and they're now do a saliva test. So that's why I'm asking. I know there's more than one type of test out there, but what are they considering a valid test?
Right. So you're right. There's many tests being run on different types of tests. And what we're asking is if a saliva-based test comes back positive, that we confirm that with a nasal swab. So we treat it from the public health standpoint as an active case. We just want to do a confirmatory test with the nasal swab, which is a little bit more reliable right now. We just want to make sure that we're, if we're going to isolate somebody for 10 to 14 days, we want to make sure we're doing it because they're positive for COVID and not, a false positive on another test.
So until the nasal test comes back positive, they aren't considered being tested or positive, correct?
They will be counted as being tested. They won't be counted as being positive until the nasal swab comes back.
So then are you guys keeping track of all the ones done at APS? Because they're spitting every week.
Yeah, so all the tests taken are reported through the statewide disease investigation system. So line lists are sent into the system daily that updates every single test that's taken in Arizona.
So I really appreciate you answering some questions for us. Is there anything, because this could really make the numbers change or be better or whatever, it's kind of hard to go get a test right now anywhere. And I don't know, is Navajo County looking at any places where you can just, hey, I want to get tested. I don't feel like I have any symptoms, but I've been around somebody that has symptoms. I want to get tested. Is that in the works in Navajo County, or is there places where it's easy to do that? Because that's part of the problem too. If you want to get tested right now, it seems like unless you're absolutely sure you're thinking you got it, you can't get tested.
No, you're right. That is a challenge. And I think it's a challenge in many jurisdictions. We are trying to work with the Arizona Department of Health Services to bring more of the mass testing or blitz testing into northern Arizona. We do have like CVS Pharmacy right now is doing some blitz testing. There's, Summit and Little Colorado have different testing times that they do limited testing. But really the criteria to get tested is pretty simple. One, you either think you've been exposed to somebody with COVID or you feel like you have COVID-like symptoms. That's the only requirement. So, if you're working with your healthcare provider and they're not approving the test, that's that organizational's decision. But the criteria is very easy to get tested. You just would have to work with your healthcare provider to get that test taken right now. But we're working on that. We know it's a gap. We know we need to do better, and we're working with the state to try and get more of that resources up here.
Okay.
Okay, thank you.
And what about I haven't heard a whole lot about the test to see if you have the antibodies. Do you know?
Yeah, so the antibody testing is ongoing in Navajo County, and it's a partnership with University of Arizona and Little Colorado and Summit Healthcare. There's a link, and I can share it with Brian to send out, where you go in and you make an appointment, you go in, it's a blood draw. There's a lot of unknowns about antibody testing right now. One, we don't know how accurate the test is. Two, there's multiple coronaviruses that could come back. If you had a common cold, for example, you could potentially come back as having antibodies for coronavirus because the common cold is a type of coronavirus. So it's not specific enough down to COVID-19. It'll just tell you if you've ever had a coronavirus. So there's some barriers there, but it is available, and I'll send that link over to Brian so you can share it with everybody.
Sure.
Thank you.
While we have Mr. Lee here, this would be a good time if you had any questions about the risk, of opening before what I'm recommending and stuff, like what it looks like or what he's projecting. Any questions like that, this would be the guy to ask.
I don't know how to phrase the question on that.
You want me to try and phrase it?
Would you?
Yeah.
So, what, Jeff, what do you see as the risk we would be looking at by opening up, say, next Monday? Some of the risks.
Yeah, I think, initially, because we don't know a whole lot about what this virus looks like in a group setting for kids, we know that the high risk population within a school initially is going to be the staff and support staff. So, how do we move forward? We have limited teachers already. We have limited support staff. If we have 2 or 3 teachers that get COVID, how do we make it through the next couple of weeks while they're out? And then, the ultimate risk, and it's something that we probably need to think about. We hope it doesn't happen. But if we have a fatality within a school or a school system that opened prior to meeting the benchmarks, we're going to get the question asked why. Why did we feel like we could open earlier when the recommendations from the state were to meet these benchmarks before we bring the kids back. So I think that's the biggest risk, I think. But, you know, unfortunately, we don't know a lot what COVID's going to look like in a school setting. They were shut down early. Kids have been pretty sheltered from mass gatherings throughout the summer and early fall here. So it's really unknown. And the other variable that we really don't know is, what does a COVID flu co-infection look like in anybody? We know flu is a little bit more serious in the younger generation. So we have a immune compromised child with flu. We add COVID on top of it. We really don't know what that looks like. So those are kind of the top risks that I think I would consider when trying to make the decision.
Yeah, that's very good. And also, if you could maybe talk just a little bit about the mandatory reporting that may come out in executive order this week.
Yeah, so much like, you know, measles, chickenpox, we're asking that the governor include COVID as a mandatory reportable to the health department from schools. And what this will help us do is hopefully contain an outbreak early within a school. We know when schools reopen, there will be an increase in cases, and we will see more cases in kids. It's just this virus loves closed environments, and kids are kids. They touch each other, they hug each other. They're kids. We all did it. They all do it. So we want it to be a mandatory reportable so that there's a process in place between the school and the health department on how we can help get in front of that outbreak, make sure that we are working through with that school the scenario of exposure so that the right people are notified, the right decisions are made to contain that outbreak to a minimal if possible.
Very good. So good points, and I just want to reiterate one that I hadn't brought out, but that I had heard and I'm worried about, if we have employees with that. So we open early, I'm afraid, and people are exposed and they have to be quarantined. We may not have the staff available to stay open, if depending on how they have to handle it, if they have to stay home for 3 days, 14 days, whatever, because there's a law in place where they, employees can have additional leave during this time. So that was very important. Thank you for pointing that out, Jeff. Any other follow-up questions? Oh, okay, thank you once again.
Yes, thank you very much.
Appreciate it, sir.
Thank you. And if any other questions pop up, feel free to reach out to us. That's what we're here for. You guys know the school business, we know the health business, and we're just helping each other out and wading our way through this COVID madness. So we appreciate the partnership.
Okay, thank you.
Thanks.
Yeah.
Thank you.
Bye-bye. Mr. Miller was in his report. I don't know if you finished or.
That was all I had. Any more questions? Oh, we will. So I guess just to summarize, we will have some classes that they meet for each day. The other classes are recording themselves and doing lessons that way, and same, also the core classes are doing recordings and getting that ready for the teachers.
Okay, that's not bad either, because some kids are faster than others, or some will get up at 5 a.m. and do their recorded classes.
Right, and that was another issue
over
with
with.
getting the set schedule for the full day is if you got a parent, both parents work, and they got to help their kid with their homework who struggles or whatever it is, it's kind of nice to leave them some freedom to do some of the work in the evenings rather than assign it all day.
Well, do we have a way for, I think I know the answer to this, but for like aides, or so like if you have a kid that has an IEP and needs help, that an aide can get them help, and
Definitely. So our
we're
special ed
working
department,
that way, correct?
yeah, special ed department, every aide and our special ed teacher has been assigned students, and they're supposed to contact them They've got it set up to where they do the Google Meet and they can share screens, and work together on that.
Because that's really important that the parents are going to need that support.
Of course, yes. Yeah, they will all have an aide assigned to them and that will work with them.
Yeah, we have some resources in place, so I'm excited about that. Good report, and just to reiterate one point that he's made here, the math and the reading, we're doing our best. He's doing his best to make sure, we're trying to get kids to do that every day. They need that repetition in math, same with Mr. Hutchins. So we're doing our best to schedule that and have some responsibility, accountability that the students are doing a little bit of that every day to keep up on it so they don't fall behind during this. So thank you again, Mr. Miller.
Yes, I have my report there. If you have any questions or want me to talk about what we're doing.
Talk to them about at least the live classes, the synchronous offerings.
Yes, what we're doing is all of the teachers have a time. I sent it out. Mr. Larson should have got it. The other two up there probably didn't get it. An email I sent out with the schedules. So each teacher will be live for a minimum of about an hour a day, teaching lessons, math 2 days, reading 2 days. They'll still have other activities and things that kids can do throughout the day.
So can I ask a quick
Go
question
ahead.
with that? Do we have a way so that when they are live, I don't notice, so I was watching my kid with one of the teachers today, and everything was backwards. Right? So he's doing math on the board, and all the numbers and everything are backwards, and he's going, how do I tell him it's backwards? And how do they do that?
That must be Mr. Bushman. We're working. we are working on that to try to figure that out.
I can answer that one. That one is Google Meets. For some reason, it switches, and I have not figured the answer out to that one. I spent a couple hours on that today, and I'm still working on it.
But Mr. Bushman, our teachers are working hard. He figured out a solution, and so if you know anything about Google Meets, you'll understand my solution. You can share what's called a tab. So you can share a tab on your computer there or a window. And one of the things he's doing now, because he has a smart board in his room, he's able to share that onto his desktop there, his screen. And now he writes on the smart board, and now it's not flipped. So he figured that out on his own, which is what our teachers are doing. We're learning and we're figuring out. So he's got a solution for that now.
We got some teachers that are writing backwards, so it shows normal. No, I'm just kidding.
So
Just kidding.
The real question is, I'm assuming, so most of the time he had his back to how did the kids ask questions, or is there ability for that? Are we working to where a kid could ask a question?
Yeah, they can do that.
If they have like you noticed, Mr. Lee, he had his microphone off. As soon as he turned it on, they can talk all they want.
But they could type it in too on the side.
But he can type it in, so...
They can type into the chat on the side.
That's how he joined the meeting.
Things like
he
that.
typed in, "Can I join the meeting?" And Jason saw it.
Yeah.
Okay, so...
And we're still learning.
Yeah, I understand that. So here's what I see, because I watched my kids. He would prep, so I know whoever's in charge of the meeting can mute whoever they want to mute.
That's correct.
Right, so that they can't, because let's face it, we got little kids and they're wanting to talk about
whatever.
Yeah. Not necessarily what the teacher is presenting, but at the same time, so if they were to type a question that he's on the board, is there somebody else in the room that's seeing what's going on? So that
no,
say,
and that's something I can talk to the teachers about. I've been nice to them this week. I haven't been jumping in their classrooms yet, so I'm going to start jumping in there next week, and I'll see some of those things, and that will give me the opportunity to do exactly what you're doing and say, hey, this is what I noticed in your classroom today, so we need to fix whatever that is.
That could be real helpful, because while the teacher's teaching,
yes.
And that's what happens a lot with us, it has the same type of thing. We have a presenter in our meeting, but we have a question, we can type in a chat, and then somebody else sees it, a moderator, and says,
I will
hey,
jump in some of their classrooms to watch them, but right now we don't have the personnel to have a person with everyone. And that's what he's choosing to do, the way he's doing it. Some of the other teachers are actually just, they're doing just like this, and they're putting it on their screen, and they're writing on their screen and things. And so as we continue we're day 2, I bet if we're continuing to this day 12 and 14, I think what you see is you will continue to see improvements from the teachers and the students as we learn more about this.
I would think that because we're in education, we ought to be some of the smartest people around to be able to figure this technology out, right?
They're figuring it out. They're sharing ideas. We're learning together.
If you don't mind me adding, I think this will be a huge plus for us in the future, learning how to use these programs, and the teachers have the time to put in to learn how to use them, which are very valuable even when we're in person. So it'll be a big deal.
It'll help us in the future. Like in the past, say a child had to have their tonsils taken out, had to miss 2 weeks of school. Well, they kindly were given a paper packet and good luck. Now the teacher could actually turn on the video the lesson, send the work home. They could watch the video again. They can do this. They could actually Google Meet with the kid at home. It's really, I agree with Mr. Miller. It's really going to help us increase our ability in our trade of teaching.
To your point of, as time goes by, things are gonna get better. Yesterday, everybody at Rochelle's was just sitting there with their Chromes and their laptops, and there was too much noise. Today, most of them had headsets on. Made a big difference.
Okay.
So just one day,
Yes.
She told parents, we can't do this, you gotta get them headsets.
Yeah. So basically back to our schedule, we're going to have the teachers will be on an hour in the morning, and then I've asked them to have an hour in the afternoon where it's cut by study buddies. So if my son needs to come in and get some help, he can just click on the Google Meet, go in and say, hey, Miss Sarton, I need some help with these fractions. I can't figure that out. She'll help him real quick. Oh, I got that, Miss Sarton. See ya. And then he's gone. They can come in. We're also making sure that we're contacting each child or parent each day. If they're not in one of those Google Meets, then we're reaching out to them and talking to them. And our attendance is probably just like Mr. Miller's. It's between 90. Some have even had 100%. They're working to contact them. We've given out 75 to 100 Chromebooks, and we're working to help people. We've been having about 4 or 5 kids come in our computer lab on daily to get some help there. So I think.
And who's in the computer lab? I wanted to ask that earlier.
Well, right now it's kind of a mix of people until the dust settles and our schedule settle. Monday was Mr. Nails was in there. Today it was part me, part Mr. Nails, part Teresa Van Hember. So once we get all our schedules kind of set, then I'll be able to make a schedule. And like Mr. Fields alluded to earlier, we're going to look at that on Friday when both of us see how many kids we have coming and possibly expanding that time. If we're having kids that are having to do assignments and it's taking them 2 or 3, 4 hours and we only have the computer lab open for 2, it's going to make it hard. One of the other things we're trying to do at the elementary school is make all of our handouts a fillable PDF, if you know what that is, so the kids don't have to print out stuff. They can just type their stuff in there, save it, send it right back. So we did have a problem with that today, but our teachers once again figured out the problem.
I thought it was me.
Figured out the problem and we fixed it. Yeah, it wasn't, but we figured out the problem and we got it fixed. So, but
It's very good.
we're doing
not hard,
our
so.
best that we can, and I think I know the teachers are working really hard and have a genuine concern for their kids. We have teachers like the first grade and kindergartner, they're meeting with those kids one-on-one, throughout the day. And I believe that will continue to happen as long as we are in the online setting.
Go ahead.
Yeah, my concern would be the good students are going to be interactive. They're going to speak up when they have an issue, a problem, whatever. My concern would be, do we have any method to find the kids who do not speak up, the kids who are having problems? They don't speak up and they aren't asking for help. Is there some mechanism that's built in there that we can identify it?
Sure. Well, I don't know if it's built in the technology, but that's a good observation, and that's something we've talked about. So that's a big change, and I do want the board to know that our principals are aware of that's one of the biggest concerns. How engaged are those students? It's going to be different than it is in a classroom setting. Check what they call checking for understanding, and when teachers are trained. So checking for understanding, we're making sure the kids have their video turned on so we can see if they're sitting in front of the screen, if there's eye contact, if they're, so all those things, the principals are working with the teachers to do our best. It's, you know, it's not going to be perfect, but engaging those students to check for understanding, to see if they are paying attention. So the more interactive, the better. That's the best I think I can answer that at this time.
And just kind of asking them questions just like you would in a regular class.
Yeah.
And also I'm directing the teachers, and they're doing it. You know, if they see students falling behind on a particular assignment or a weekly formative assessment, boom, they're going after them. They're going to help them. Their job is success.
Yeah.
So, and the kids being successful. So
I
that's
think
what they'll do.
The more interactive we can be with our students, the more successful we'll help them be.
Good.
Yes. That's why we're doing that lesson every day instead of just showing videos all the time or whatever, or just showing even a video of Mr. Bushman teaching that lesson.
Thank you. That's
right.
good. So I hope that answers it to your satisfaction. But it's a concern, but we're trying to address it.
Any other questions for Mr. Hutchins? Thanks, Mr. Hutchins.
Thank you.
And that takes us to Mr. Mills.
Well, I'll spare you. I just wanted to talk about board book, and then of course I have my attachment there. So if any of you have questions, I don't have anything else to add.
Okay, one thing I do want to, this is a real good time to let you know, I'm having a really hard time seeing all this stuff, all these attachments. And then whenever I make it big enough that I can see it, then it's only part of it.
Those 3 dots will make it full screen up on the right.
Says download or print.
Yeah. Full screen at the top button.
Yeah, that's all you get is download or print.
Up here. That's where I thought I saw it. So.
Download or print.
Yeah. Steve, you had mentioned that it gave you a full screen option, but it's not on
Mr.
this.
Fields, it does on mine. I don't know, maybe it's
How are you doing it?
just the same thing. When I click on those 3 dots up there, I have
See, all
Her
I'm getting
3
is
dots.
print,
and
download,
print.
full screen, and
All
I
I
did
get
it.
is download and print as well.
Yeah.
We don't have the power.
Well, you know what?
It is
That's
an
all
Apple.
I have. That's all
It's an
I
Apple
have. Relax. No, that's all I have too. So I know you showed us on the demo, Steve, that you could do
What
the full
about
screen.
on the hand and go to fit? Nope. Got
No, I don't know. I'm looking at my iPad, and it has the 3 dots. Oh, I see what you're saying. That doesn't have it just says download. Yeah, I'll look into that.
If you
I'll have
would
to call
please, because I
support on
can't
that.
see this stuff. And these are new glasses,
Okay.
so we can't use that.
Yeah, that's important. Thank you for pointing that out.
Yeah. The whole program, I can see stuff.
So any questions for Steve?
Can't see it.
Can't see it. All right, let's go to.
We can get this printed out for you right now. Kathy, do you mind Steve's attachment?
Shall we move on to technology?
Yes.
Yeah, let's do that.
All right. Jason, come out of your. There you go. I was gonna say caveman. I thought, no, I won't put it that bad.
We've talked about a lot of what I was going to go over. I was going to start off with any questions. So it's been a pretty good 2 weeks of teachers coming in and students coming in. Let's just talk about how we gave out a good chunk of our iPads or our Chromebooks. We also have more Chromebooks coming in soon. We're working on teachers with cameras and microphones, trying to make it as smooth as possible for teachers, students, and parents.
So
we're training 3 different groups here.
yeah, my question for you is: I know that this. After just a couple of days, do you foresee a problem of getting buried with technology problems?
So every year, the first month is always crazy when students come back.
Yeah.
It doesn't matter what you do or try to prepare during the summer, it's going to be crazy. This year's a little bit more different, but I don't say get completely right. It's just a different.
So what are your recommendations for these homes that have several screens going.
So like you said, headphones are gonna be the only way to do that.
I'm not talking about that part. They kept getting dropped
Bandwidth,
today.
Wi-Fi.
Wi-Fi was.
Wi-Fi, yeah, that's tough. So CenturyLink, is, if they have CenturyLink, they're not gonna have the high speed as cable one. Cable one, you're still gonna max out at whatever plan you're paying for. So every home's gonna be different. If you have 8 laptops going on and you're at 20 megabits a second, you're gonna be hitting lags or drops or all kinds of.
So my question to you, if she averages 7 or 8 kids a day, what does she need to do to be able to handle that?
That was tough, because I don't know the schedules for all the teachers, because every teacher's probably logging on at different times, maybe they're all logging in at 8 o'clock. But maybe they can talk with teachers, or maybe with principals, say, hey, let's stagger. maybe-
Okay, so
Well-
you gotta understand, there's one person overseeing all these different grades,
Right,
and she's gotta be able to keep everybody busy.
but as they talked about, average screen time a day is only like hopefully 2 hours for the high school level. If we can figure out how to stagger that maybe a little bit, so where they're not all 2 hours right at 8 o'clock. then-
Well, she's babysitting, and so she's got all the kids together at the same time. So I don't think she can stagger.
Okay.
But we have the computer labs that are open. That would probably be the
And how's
easiest.
that gonna help her?
Bring the
Send
kids to
them-
the
Bring
computer
the
lab.
whole family?
Bring them,
I would.
bring them down.
If the internet's not keeping up, that's what I would do.
They can
but-
all watch it here at the school and not miss a beat. Yep.
Well, and the other problem is too, to her point, is yeah, you can stagger it, but if I got 8 kids, so I've got one kid getting a live, but my other kid's doing homework, and that other kid's doing homework, and you know what I'm saying?
Right.
Because I don't have 8 at my house, but between me working from home and my kids' school from home, we push my bandwidth pretty hard too. So, and it's not just, I mean, I have one kid, he gets on and he's done. He's done his homework, and granted, sometimes we find out he hasn't really done it, but I've got another kid that he takes forever on the computer. Yeah, we said 2 hours, but he can't get it done in 2 hours because he's just, granted, most of the time he's probably just sitting there staring at the screen, but.
So I know every family's gonna have different scenarios, and that makes it hard. Yeah, the easy solution for the IT department, bring them to the school. They have, each school has designated times where they can come, but as of right now, that's gonna be the best solution. And yeah, I can come up with some other ideas, but.
Or she's gonna have to go with the higher data plan. To
Or
give
go
more
with the-
bandwidth
That's
at
what
home.
I'm asking,
That's what she's
is
gonna have to do.
what is gonna,
Cable
what
one.
is going to,
Cable one and a higher plan.
For 8 students, you're gonna want 50 megs or more. It's a second.
and is there even any of that?
Cable One is the company to do that with. CenturyLink, I don't know. If they, sorry.
Yeah. Well, thanks a lot. That means they're coming to my house.
Yeah, that's a good, I mean, there's probably a lot of parents that are wondering, how much data do I have to have for my kids type of thing.
So I can just give you random stats real quick. Like one Netflix movie streaming at one time is anywhere between 3 and 5. It's a Netflix movie. So streaming with a teacher on school, it's probably anywhere between 1 and 5 megabits a second. So you divide that by 50, that's how many kids you can get, give or take, depending on routers and modems and computer speeds and all the above. A lot of little tiny things. But go, I'll keep it simple. Go with 50 megs, you'll probably be fine.
So I'm going to throw this at you too. Do like Wi-Fi boosters help in your home? And with that, so like if you have your big house and you got one kid in the kitchen, one kid in his bedroom, one kid in another bedroom, and this one's not, instead of having to pile them all in one spot so you can spread them out,
Does that help?
does a booster help?
So it doesn't speed it up at all,
Right.
but it does give you a better signal. So if you only have 2 bars on your laptop, then your signal and your quality is all going to go down. That's the
Right.
further way you go.
Jason, your mic isn't working. If you could use something else.
You can attach this to your shirt.
That's not funny.
I'll take those over.
Nice.
What was my question again?
The Wi-Fi.
Does the Wi-Fi booster help?
Wi-Fi boosters help for signal only and not for speed. If that makes sense.
But if you're knocked down to 2 bars instead of full bars and then you boost it, your speed might
Right.
actually.
So your kid in your basement is going to have that much more speed. but it's still going to be maxed out on your internet provider and your router.
Okay. So boosters help it go further out. If you put a big enough booster,
Or you can go out and build stuff like that.
outside or.
Oh, so I can put them to work outside and do their
No,
homework at the
I
same
wouldn't.
time.
Headphones on, put a webcam on it.
I'm just kidding.
So yes, we have a lot of different little tiny hurdles for parents, for students, and for
Teachers, and this is our second day in, and we're getting real. For example, like, why is our Google backwards, or why is it mirrored? We had a problem with the mics for a while, or in the webcams for a while. What do we do with kids that don't have webcams at home? So everyone can see everyone except for the kid without the webcam at home. So hopefully we're solving problems like that with the Chromebooks and so they're handling on. But yeah, we're doing the best we can.
So, how about instruction with the, because you brought up webcams, so when you give out a Chromebook, are you telling them, hey, when you open the Chromebook, don't open it by the camera, open it by the other side, because as you twist that camera, you got a decent chance of messing up the wiring for the camera? That type of thing? I mean, just basic stuff. How do you open it,
Right. So
close
there's
it?
a little bit of training. Hopefully most, it's going to be the younger kids that are going to have a hard time with that.
Mhm.
So I know, for example, the first and second graders, they have to have a parent there with them or they can't get on. But your junior high and your high school kids, they're actually doing really well. You know, that's the camera.
the mic and
The camera works great. But your first and second graders, they're struggling with it. But I tell you,
Truth, they're actually
did not. And I think Mr. Hutchinson and those teachers are actually talking
with the conference.
like we're doing here with first and second graders. And maybe even those kindergarten, I think they had kindergarten conferences.
Yeah, they did. She has them.
Yep, that's what I thought too. But I mean, everyone is jumping on and you're literally.
Interacting with every single student in that class. Everyone, it's just like normal class, and the teachers, shh, everyone, please be quiet.
And then they have class. And it's actually really kind of cool stuff.
Cool. That's what I'm hoping for.
So, there's still going to be a lot of bumps, but we're getting there. We're getting really close, actually.
Anything else for Jason?
No.
Hey, thanks for all the hard work. I know that you're putting in some time getting this going for us, but it's important for our community to be able to do this online school. So thank you.
Yeah, thank you. Yeah, he's done good, so appreciate it.
Brings us to Brad. I haven't seen you for a while. Yeah.
Good to be back. You have my work order and our work logs. If you have any questions on that, I can answer those. Other than that, we've been working mainly on aesthetic things around the school. We were able to paint the field house bleachers. We've had some vandalism, some graffiti over the years on those, and we went in and erased all that. We had to end up painting the interior of the girls' softball dugouts because they had been painted up so bad. But we've just been working on a lot of the things that, that either the damage that was done over the riot period or just things that have needed done for a long time that we now have the time to do.
I said this to you the other day, and I want it open to the public to know that I can see all the hard work you and your crew are doing, and I appreciate it. The campuses look very nice.
What you pay us for. Thank you.
What did you say?
So now I'll make a comment that shows that we're in a small town. Did you have to help the person get their cows off of the fields
Don't
that were
even
on the
go
cows
there.
the other day?
Do not go there.
Welcome to small town school, man.
All parties involved in that were responsible. They did what they could as fast as they could, and there's no complaints on my part.
Oh, hey, I've had cows before. I'll tell you what, they will get out of anything, man.
They found their way in. We had no idea, but they were there.
What about damage to the field? Any damage to the field sustained?
There were a couple areas that on the practice football field, they came across it first, and we keep it very, very wet. And so we do have a few tracks out there, but nothing that won't go right in.
Okay.
Glad to hear it.
I think that brings us to the end of the presentations. which brings us to call to the public. Do we have anybody signed up? Yes. Okay. Where is it? Oh, I guess it's under description. So individuals who wish to address the board are requested to complete the appropriate form prior to the meeting and give the form to the board secretary. Members of the board may not discuss items that are not specifically identified on the agenda. Therefore, pursuant to ARS 38-431.01, action taken as a result of public comment will be limited to directing staff to study the matter or scheduling the matter for a future agenda. The board requests that all comments be limited to 5 minutes or less, that speakers refrain from the use of speech or language that is offensive or inappropriate, pursuant to board policy KFA, and that speakers refrain from voicing complaints against school personnel or any person connected with the district as it may impact due process rights. Policies KE, KEB, and KED are provided by the board for disposition of legitimate complaints, including those involving individuals. Forms required for use of these policies can be obtained from the Joseph City Schools website. The president will limit discussion whenever he deems such action appropriate to the proper conduct of the meeting. And we have Mrs. Balda up first.
Yeah, we'll make sure she has a microphone.
Remember Mr. Microphone?
It's just an idea that I had that I thought might be helpful, that I thought maybe the board could consider in the future and then maybe decide if it's a good idea. So one of the main problems with the pool, do you want me to come up there, Rhonda? Okay. One of the main problems with the pool that we've had throughout the years is the heater going out regularly. So we'll have it for a few weeks, and the pool's going great, and everyone's coming, and we have great turnout, and then the heater breaks. And that was one of the biggest problems, like at the beginning of the season. The heater was going great, the pool was all warmed up, and then the heater broke, and it didn't get fixed for a couple months, 3 months. And so we weren't able to finish the lifeguard training when we were planning on finishing it, and so that kind of delayed everything. When the pool was back up and running, we had to finish the lifeguard training. Anyway, so it's a continuous problem. So just a couple days ago, the heater went out again. It's still not working, and so I think they're trying to figure out the problem. And my idea was that maybe it would be a good idea to like maybe invest in someone on our maintenance crew, or find someone that we could hire that would come in and do regular maintenance on the boiler, like every couple months or every month, however, whatever seems reasonable, because it just seems like you get it going and it's carrying, when the pool's running, that boiler is carrying a pretty heavy load. And so I think it's just not yeah.
Mr. Fields, isn't that boiler doing more than just the pool?
Mm-hmm. The domestic water. And not that it'll make you feel any better, but prior to 10 years ago, when we separated that, it was a lot worse.
See, I don't.
It's true. It was. I mean, you think it goes down a lot now.
Yeah. And this year, actually, this is the first summer since I've been back that, like, of course, the pool hasn't even been open, I think, for 2 months yet, but like it's consistently been at a steady temperature for the first time since I started working for it, and since I've been back, like, in this town. So it's like really, it was really nice not to have to deal with that. And then it started happening, kind of happened right in time because we were about to, close for the season. But
when we first opened, it was no issues that first summer. Like when we shut it down. Remember, was
I don't think I was back then
5
yet.
years ago.
I wasn't back then yet.
Yeah,
I was still in the valley.
What's wrong with it right now?
We don't know. We're trying to figure it out.
So
they're still trying to figure it out. It's not on right now.
Left.
So, but I think they ordered an on and off switch to see if that's the problem. If that's not the problem, then they're going to kind of go from there. But anyways, I just thought it might be a good idea, something to consider. It might save us trouble in the future, and it might save us money in the future if we can do regular maintenance on the boiler than having to like wait till it just goes poof and stops working, and then we have to figure out what part it is and then wait for the part to come, and then they send the wrong part, and so we have to wait till they send the right part. That's been a problem in the past. So I just thought it might be a good idea. Maybe if there's someone on the maintenance crew might be interested in getting trained in that or whatever, it could be an asset for the school as well and save the school money. So that was just an idea I wanted to throw out there. And that's it.
Okay, thank you.
Thank you.
Do we not have any kind of a PM schedule on that?
We do. That one's a little tricky. But no, I'll look at the short answers. I'll look into it. Like we can only do so much on it because
Right.
It's a boiler. But I have got service agreements on it before, and it's not as bad as a chiller. So that's actually a good idea. I probably should have one in place right now, and maybe that would prevent these little issues. Some of the issues I think we deal with them they're like controls, and we don't even have to get into the boiler.
Right.
So it. Like the last couple of years, we tried to skimp by without getting a service agreement with the proprietary vendor to, and it seemed to work. We were able to just address needs, but let me look and see what the price is for it now. That's something I think we should consider. Yeah.
Thank you. Okay, next up, Mr. Winter.
Yeah, tonight I want to extend the appreciation. I cannot speak for the election board, but for the election committee that we had here is all brand new people. And we didn't really know what was going on. We had one day of instruction, and I kind of took a lead and worked with Mrs. Mitchell, and we want to know what you guys to know how much we appreciated her efforts, how much we appreciate the janitorial staff for setting up, for their efforts in taking care of us, providing us with extension cords when we needed it. We want to thank the staff and the board for their generosity and their time in making that a success.
Thank you for your time.
Yes, thank you. All right. That brings us to the consent agenda, number 4. And it's harder to find on this, but I'm assuming it's just everything that's 4s.
Scroll up.
Until you get
Yes.
down to 5?
Yeah.
Okay. So everything that has a 4 in front of it, 4A through 4F, consent agenda. I'll make a motion that we approve the consent agenda as listed.
Second.
Have any questions on anything in the consent agenda? Okay. Other than thanking Jeremy for his time on the board, he's been good to work with, and it's a bummer that he resigned, but we understand why. But I want to thank him for his time. All right, let's call for the vote. Myself, yes. Rhonda?
Yes.
Dayton?
Yes.
Thank you. That brings us to personnel requests. 5A, new position.
Yes, so you have a recommendation from us to add an assistant cross-country coach to help with that program.
Okay. So since that hasn't started yet, are we going with what we think the numbers are going to be that we need an assistant coach? Or, I mean, I'm assuming all these people that we're hiring as coaches, if the AIA decides, pending the argument, or not argument, the discussion we had last month. So like this would be a new position. If we hire one, they would understand if there isn't a sport.
Correct.
Or if there isn't enough numbers for a JV or an assistant coach.
So a couple things along those lines. Yes, all the coaches will know that if we don't coach or don't have sport, then we're not. There's no pay. This position is a third on the coaching, so it's not a head coach or a JV coach. It's the next level down, and it's just to provide a second
Adult
supervise.
Okay, so it doesn't matter. Numbers, just we
Right.
need another supervisor out there.
So
Having
we
2
only-
adults.
If
with
we only have 2
kids.
girls come out, then
Oh, yeah.
we definitely wouldn't do it. But yeah,
And we're looking to the future too a little bit.
Right.
That's what.
just like to have the option depending on that situation and have a second adult.
So we've talked to all coaches and said if no sports, no pay, or do we have something going like, well, you've been a coach and you've been counting on it for I don't know how many years, will we have an option?
Mr. Fisher can talk more on it probably too, but the ones I have personally talked to, I said, hey, if something happens and sports cancel, we'll work with you to provide other opportunities.
You said we will provide other,
Help recoup
okay.
some of the
That
funds.
was my question. I was like, wait a minute, I thought we agreed last time
So they
that
wouldn't
we
be
were
paid
gonna
to
do
say
something.
football doesn't happen, we wouldn't have a football coach paid, but we would have other options for them to make some money. We can't pay a football coach if there's no football season. So let's say it's
Right.
canceled, then maybe we set up I'm just throwing ideas, an intramural sports season, they let kids come out and do stuff and maybe they run that, or we would come up with ideas that would benefit kids that would allow them.
And let's ask these coaches to come up with some ideas.
For sure.
They know what their abilities are.
Right now, it's looking like sports are gonna happen, so hopefully we don't have to worry about it, but yes, we have discussed that.
All right.
Did Mr. Fisher want to add anything? Are we good?
Yeah, I feel more and more confident about sports. We're actually meeting right at least tomorrow, for junior high sports tomorrow. And again, if for some reason these sports don't happen, there's a lot of things.
I apologize. If these sports don't happen, not only are there a lot of things that the kids need, but there's a lot of things that you could put under the heading of deferred maintenance within the department that we need to take care of too. That would give us an opportunity to have inventories updated and really cleaning out and looking at our facilities. And there's a lot of things that these coaches can do, and there's also a lot of professional development that we're going to be working on this year too. So I think there's a lot of initiatives that we can look at to help them recoup some of their money if they don't. But I'm feeling more and more confident that we're going to have sports this year.
While we're on the topic, the AIA published some guidelines, parameters for sports to follow if they open. I don't know if you guys received that, but Mr. Fisher's going to make sure, or already has, that all the coaches get that and that we're going to follow those just to protect the district and make sure that it's consistent across the board with the social distancing.
So the AIA is working with the health departments and all that as well?
Yeah, the CDC, long document that they've given us.
They also have their own health, I can't remember what they call it, but they have people on their staff, they have a health department in the AIA as well.
Okay. With that, I guess if I can just throw something, I'm on the sports advisory committee for wrestling, and as the wrestling coaches, that are on that committee are already starting to talk about what wrestling needs to look like, what precautions we need to take. So that's being addressed, even for the winter sports now, the sport advisory committees, with the medical advisory committee that the AIA has. We're working through that for common sense approaches to how we keep kids safe. And so I know that's been done for football.
Like, give us an example, like taking their temperatures before they're able to wrestle.
That's some of the things. I think one of the things I got to kick out of was football. The football, when the rules came out, they're going to extend the sidelines for the players from the 10-yard line to the 10-yard line so they can have better social distance. Coaches still have to stay between the 30s, but the players can spread out all the way to the 10. So I know Coach Larson and Coach Layden and those guys, they're going to have some smart kid down there at the 10-yard line telling them what's going on.
That sounds like it was developed by a coach. That doesn't make a lot of sense.
That doesn't make any sense. The coach should be able to roam as far as his players can.
So, and there's some other things like that. Kids bring their own water bottles. Extended time between periods so kids can get a drink. Extended halftime. Extended timeouts so that kids can have their own water bottle instead of group water bottles. Things like that. I know with the Wrestling Advisory Committee, we're looking at how many times they need to be tested during the season. We're looking at oximeter readings, pulse oximeter readings, whether we need to do that, temperatures, what tournaments need to look like. I think tournaments are going to be a lot smaller.
Are they also looking at not letting there be audiences and spectators?
That's up to schools, I
that
think.
That might improve the reffing.
That what?
That might improve the reffing. Yes, I do. I do know that's one of the concerns. I know that for football, for us, we can have our largest crowd ever and still socially distanced because of the room we have in our stadium. Whereas for a big school, that's going to look different. Obviously for me, one of the biggest, most crowded things we have is our wrestling tournament. I know that's going to be smaller this year. We've already made that decision to be a little bit smaller this year. If nothing else, for efficiency. Then the question is do we let fans in? How many fans do we let in for a wrestler? And that's being discussed. And it's also being discussed for other volleyball and those things.
That's a decision that's made by the district, the crowds.
So the AA is leaving the crowd situation up to districts.
Am I right in that? I haven't seen anything that they have mandated.
That's my understanding.
On those lines.
Yeah.
I haven't seen anything from the EIA other than their guidelines and their recommendations.
So, as a coach, one of the things I saw early on, which I thought, how are you going to manage that as a coach, is like the AIA, an original thought or recommendation was only have, 3 kids in the locker room at a time, so you have to stagger when your kids are in and out of locker. I'm like, that is a nightmare for a coach. Have they stuck with that kind of thing, or is that thing weird?
No, I think they're starting to accept that teammates are going to be around each other so much that they're going to ride the bus together according to district busing policy. So I think they're starting to become more. One of the things for wrestling was they were suggesting that every wrestler will take a shower after weigh-ins, which means you're going to take 250 wrestlers and put them in those little locker rooms, in those little shower areas. And so we sort of pointed out that would be
crazy.
They don't shower after everyone over. He touched on a very important point here that I think it's important for us to consider. Like with the football sideline rules, a lot of these rules they're coming out with are for other situations than us. Like a football game at a 4 or 5A place may have 70 people on the sideline when you count all the reporters, all this stuff.
More than that.
Yeah. And our sidelines, in junior high games, sometimes there's like 1 or 2 on the sideline. So, we got to remember that some of these rules are being developed for much larger places than what we have. That's all I'm trying to say.
I feel confident we could have our largest football crowd ever, and we can still accommodate them. We just have to be smart about how we use our space and talk about it, and be smart about the concession stand. That's the only thing I see is that's where crowds are gathered. So I feel confident that we're actually better off than these 4A, 5A, 6A schools. We're much better off.
Okay, thank you. But I'll make a motion that we approve the new position of an assistant coach, high school cross country.
I'll second.
Any more discussion needed? Okay, myself, yes. Rhonda?
Yes.
Dayton?
Yes.
All right. That brings us to 5B, employee assignments, and this is a really long list.
So you have a motion here for all these. Now, if there's any issue, we can take one out. We can modify this list, but for efficiency, basically, we've put them all on this one list. So your approval will approve them all. Now they only get paid if they do the job, if they work, or do something in lieu of that's been approved by administration. But you can take people out as needed, but most of these are cursory assignments.
So you can always amend a motion if needed.
Yes.
So I'll make a motion that we approve the employee assignments, employee renewals, volunteers, and employee resignations as listed.
I'll second.
Now we have discussion. So I did have a question. Why do we have extra duty assignment? I understand drama coach, but band choral director, isn't that what he does?
That's been a stipend that's been around for longer than me, so longer than I've been principal. That's what they do for like football games and the extra time outside of school that they spend on top of it. It's more than a normal teacher.
That's been around forever?
And it should be.
Okay.
Well, that's
Because
like
he's
playing
putting in
music at the
extra
football
time
game.
Out of
Games,
class,
concert,
don't
the
you
extra
think?
stuff outside of school.
Kind of like a coach.
Yeah, that one.
Like math.
Like they'll take kids to all region on the weekend.
No, but this is a
All-state,
regular
all that
thing.
Yeah, the drama coach one might be a little new though. That might be the one he's thinking. I don't know, but yeah.
Talking the band choir or band choral or whatever it's called.
No, and the drama coach is a new one. I haven't seen that one before, is it?
Well, last year.
We talked about that
For the
last
musical.
year.
It's
That one was
for
last
the
year.
musical.
I thought you were talking about band. That one's new last year.
So if
Once
we
again, if they don't do it-
can't have a play, he doesn't get that.
That's right.
Okay. Other than the rest of them, I see we have the Ag Club advisor. Glad to see we got one there.
Does anybody else see anything else in there that they were wondering about? Oh, what is the all sports injury prevention recovery? I have not seen that one before, and I was thinking, hey, it would be nice to have one, but I've never seen one before.
We're very lucky. Sarah Napa'a has volunteered to serve as that. She's a licensed massage therapist, and she also has some experience in sports recovery. The vision there is that she would come help coach stretching, injury recovery. She's got experience in education in that area that would help us with any number of things. For me in wrestling, I've thought about the whole advanced stretching, injury recovery. If they've got a pulled muscle, she would be very good at helping them understand how to take care of that, how to take care of that injury better, and help it be another resource.
Okay.
Not a full athletic trainer, but somebody who could help.
Yeah, that's what I was
cramps
wondering
and,
about. I see it. It's great to have a volunteer. I mean, awesome. But that's what I was, because I think most sports are just like the two that I coach, but they come in to ask, football specifically, do you have anybody? So this would not cover that. We still say, no, we don't have a
ability.
Right.
But this would be more of a.
This is just more of a help for injury recovery type of thing.
A great. I've got a young man who's doing our strengthening and conditioning right now, who's got a shoulder that's injured, and helping him understand how to take care of that shoulder better, how to massage that shoulder and work the kinks out of that shoulder, is one of those things that I know a little bit about, but she's got she's a fully licensed person in that, so
that's great.
I figured for free, it's a bargain.
Any other questions? All right. Call for the vote. Dayton?
Yes.
Rhonda?
Yes.
Myself, yes. We especially appreciate our volunteers. Okay, that brings us to 5C, personnel appointments. I'll make a motion that we approve the personnel appointments as listed.
I'll second it.
Any questions?
Nope.
Okay. Call for the vote. Myself, yes. Rhonda?
Yes.
Dayton?
Yes.
All right. That brings us to textbook adoption. I'll make a motion that we approve the textbook and curriculum materials as presented.
No second.
Any questions? This is the one that's.
Evidently, I totally
We did
stepped
the
through that.
we did the 60-day review, so it was like 2 months.
Probably the one
2 months
time I
ago
didn't
that we
come.
had it for review, and now this is approving it. Has there been any
Any input?
input from community or anything? No.
I know Mr. Winter has reviewed it. Yeah.
I was just wondering if we had any comments, because that's why it's out for review. So, okay. Call for the vote. Myself, yes. Rhonda?
Yes.
Dayton?
Yes.
Okay. That brings us to the fun one. Probably. I'll make a motion that we approve the resolution regarding opening of school.
No second.
Okay, there's our second. So now we can discuss it. And I don't think anyone is, with all the whereas and foras and therefores on this thing. What are the highlights and what do we really need? I haven't had the opportunity to study it as much as I should have. So I guess I'm asking for me. What are we looking highlights?
So, there's not a definite date. It's indefinite for reopening. This is just if you scroll down there to when it starts to number.
In conformity with Order 1 of Executive Order.
Yeah, so this was the latest executive order from the governor, the one that ends in 51. So this is the one that it was actually right after our last board meeting, I believe, when we had a discussion on mask, requiring some mask. So there's a policy out there now. Actually, it's later on the agenda about this, recommended by the ASBA. But anyway, saying that we're going to take recommendations from the county or consider them before opening, and the CDC and those statistics. But as been pointed out, there are some concerns with all that. Other than that, it doesn't give an open date. Basically, it extends. We were planning on doing the 17th. So I can answer any questions you might have on it. I'm looking through it myself right now too. I don't know if he's pulled it up for the audience. Yeah, so we take recommendations from the state, CDC.
Pretty much what you already told us.
Yeah. We have to post certain things, get our plan submitted and put to our website. Some other things have to go to our website, which has already been done. Our mitigation plan, they refer to that several times in here. That's like our plan of, and that's posted to our website, of the actions we're taking to prevent the spread, like putting signs up, taking temperatures, asking for the masks to be worn. Those things are our mitigation plan, and it is on the website. I believe it was one of the attachments.
And aren't we also doing extra sanitizing and cleaning?
Yes.
And that's in plan for when the time comes that the kids do come back to school, there'll be more of that.
Correct. Like we upgraded the filters, air filters in all the rooms, and we put more. So we're gonna make sure those get replaced.
Now I know that in the office that they have those, that Mr. Neal put those lights in there. Are we doing anything like that in the classrooms?
Yeah, I received some mixed information about that after the fact. I don't know what the latest is. First, I heard they would work, and then I heard they wouldn't. So have you guys heard?
That a lot of surgery hospitals,
they do them.
They have them. They shut a room off, and there's one that is in the room. They sterilize it, and then they bring it out, and they take it to another room. So, and this was before any of this came out. I've seen those.
Yeah. We've looked into electrostatic filters, and I did a little research on that. And I actually asked the county health director about that at one point, and no one really was committing that those would be an improvement to the health situation, because in theory they work better, but they take a little bit more maintenance and stuff, and cleaning.
And it's only theory, nothing proven.
Right.
Okay.
But we could do the lights like you're asking. It would be an expense if we did that more places. Those were designed by Mr. Neal.
I think the biggest question on the lights is how much area do they cover?
How much what?
How much area do they cover?
How close to the athlete?
For example, when we put one in a classroom, I don't think it would cover much more than just right. So.
Kathy, where's the one I put in here?
Right there.
Oh, okay.
Well, that's not like what I'm talking about, I don't believe. I mean, they flat shut those rooms down, and you can see it way down the hall, stuff happening. I just wondered if we had thought about something like that.
Yeah, I've thought about it, but we haven't
Looked
committed.
into it.
Yeah.
Probably too expensive.
There would be an expense.
This is a resolution we're supposed to pass for the governor's thing, right?
To keep us in compliance.
Yes.
It's recommended that we have it in place. We did, and it replaces the old resolution. We did have one from the spring, so this kind of updates that.
Okay. Any more questions? Okay. Call for a vote. Myself, yes. Rhonda?
Yes.
Dayton?
Yes.
All right. a good thing we all agree tonight, because if one of us doesn't, it's a no. Okay, policy and regulation adoption, first reading.
Blah, 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 blah.
I can give a quick summary on these once you guys.
I'll make a motion that we approve the first reading of the policy and regulation adoption.
I'll second it.
Okay, so there was one that we or that I am not recommending to the board, and that's part of the advisory. It doesn't apply to us, but the ones listed in the description, quick summary on those. And remember, this is just the first reading, so we have the opportunity to modify or look at these again. Executive session. So there's 4 basic reasons we can go in an executive session to discuss something. This policy would add school emergency planning or plans to that. So that way, that's not a public discussion necessarily if we don't think it's appropriate for it to be. Like where, I don't know, where we might keep equipment to prevent an attack or something like that. If we don't want that to be public knowledge, we can go in an executive session to discuss that. That's what that covers. You can see the wording. The wording's attached. Basic instructional program is just an update of what we are to provide in education, and it also, I believe, adds a statement about parental rights or notifying parents of the basic instructional program. This is something I think is going to have to be added to our website, if I remember correctly. The next policy, parental involvement in education, once again, an update. They're adding verbiage in there that ensures that parents are made aware of any changes in curriculum, especially like things that are controversial. There's been some issues down in the valley where evidently some parents didn't feel like they were notified or were involved with the curriculum decision. It's not really an issue in a lot of the rural areas, not been one for us, but they're putting this into the wording to protect parents.
Okay, but we're going to have to adhere to it as well, won't we?
Right, and so it wasn't supported by everybody, I think, in the ASBA because of, it's like more mandates. Now we got to make sure we get things signed off on or posted to the website, which is okay. It's relatively minor. It shouldn't cost us more, but it is one of those things that's
going to take somebody some time.
Yeah,
probably you.
Yeah, there were laws that they were proposing that said. Every resource a teacher uses has to be signed off. That would have, when we talked about that, the principals, that's not what they ended up doing. But they did pass a law that modifies this policy. Staff personal security and safety and student dress and visitors to school all include the same statement. If you look at that, it's a mask. It says we have to have a policy in place that requires masks. It gives the exceptions or alternatives. Like if there's a health issue, we don't, or whatever. And it does have a statement in there that says the superintendent, after taking strong consideration from places, can create a waiver for the mask as well. So that's part of it.
So that's going to be the norm. You have to wear a mask
at schools
at school to come in. Everyone, if we accept this.
Let's pull up the actual wording so I don't misspeak here. So I don't know if Steve, are you there? Can you pull it up for the public too?
I think he went to bed.
So I'll find that.
It should be on the big screen there. I don't know if it's a public can see it or not.
It's blank. I think it might have went to sleep.
Click to exit full screen.
Okay, Steve, you're gonna have to exit out of full screen. It's not working.
Okay. So if you go to page 10 on this document, the underlined stuff is the addition, the additional, and he we'll get it pulled up here, but just to sum it up, the exact wording here, It's face coverings, not mask. So there is a slight difference, but they're not to be worn by children under 2. Well, we don't have children under 2 here.
It doesn't show when you go full screen.
Anyone who has trouble breathing is precluded. Page 10 on the thing, and everyone should be able to see it.
Mine's not.
So anyone who has trouble breathing, if you're under the age of 2, or anyone who is unconscious, incapacitated, or otherwise unable to remove the mask without assistance, of course, would not be required. Yeah, that's how it's worded. Anyway, it says the superintendent may make exceptions to this requirement to wear that.
Wow.
And so this is the same wording on all those final 3 policies that are from the ASBA, recommended and required by the governor, that if we don't do this, we got to do something else similar. So I guess the question was, this is going to be the norm for everyone as it's kind of part of the dress code.
Mine won't come up.
Buses, that's included. This could be, it doesn't say this, but it could be, it appears to me that it could be removed if the crisis was over, like a vaccine comes out, and because it's listed as a regulation.
And this is
Matter of fact, I heard that too. They did report that to me now that I said it. Go ahead.
well, it says cloth.
Right. That's correct. Good pickup, because that wasn't clear at the beginning. So what's the alternative to cloth? Is that what you're asking?
Well, yeah, I mean, that's
Like a shield, I guess, would not count.
paper.
Paper mask, is that what the ones with the little rubber bands are?
Yeah.
In
And then you
94s?
also can wear a face shield, which to me is better than all this other. Because it's protecting your orifices more than just the mask.
Yeah. I don't have an answer for you other than this is what we're supposed to do. So they did word it as cloth face coverings. That you're absolutely right. Nice pickup. That's
So if we don't adopt this regulation, what's the consequences? No school period?
Wasn't quite ready for that question, so give me just a sec. We have, by law, we have to adopt a face covering policy that requires everyone wear one. It can have a clause in there saying we can have exceptions. So if we don't adopt this one, I go back to the drawing board and draft one and see if you guys like it, or you draft one.
So the problem I have with it, well, one of the major problems I have with this is, what do we do with, because I have 3 of them that are going to come to school and they're just going to have enough with that mask, and they, where's your mask? Well, I left it on the playground. Well, go get it. Or why don't you have a mask? So now you're going to have to adopt disciplinary policies or whatever.
Yeah,
what do we do with this?
Good question. Now we're clear. I'm picking up what you're saying. We got to show a good faith effort to do this. We got to show that we're making an effort, but we don't anticipate being the face covering police.
Face covering police?
Yeah, we're going to try with fidelity to enforce this the best that we can. But like, for example, they say that you take one of those masks off one time, it's contaminated. It's not, or if a kid puts their hands on it, it doesn't do the same as when they test that it does. That's when everything's pretty much out the door. That's why we had remember last month, that's why we had a fundamental problem, or I did, I'll speak for myself, not the governing board, with enforcing the mask, because it's something that was not something viable that we could actually enforce. It doesn't, they're putting us in a situation that if it doesn't fix anything, why force us to do it, you know? Because these masks, you take them off one time, they're contaminated. If we were to provide masks, we were talking about providing 3 a day that they would have to be required to wash. You know, they take them off at PE or lunch, put a new one on, and then you have to wash it and bring it back. How are we don't have the resources to ensure that. But this is a step showing that we're trying to
Play
go that
the
direction.
game? Is that what you're saying?
Whatever, yeah.
Kind of like when I go to Winslow, I wear one of them things.
Okay, yeah,
And my O2 level goes down to 79 because of it.
Yep. That if you have any trouble breathing, you shouldn't have to wear one, and that's actually listed in the policy. So,
but
does that answer
for
your
us
question?
to be in compliance, I would need to sign a waiver for you to keep on file. Am I correct?
Partially, not. It depends. No. First of all, you're not a student here. Second of all, you have trouble breathing. That's listed in the policy, right? I mean, we haven't gone that far in our discussions, but technically, the way the policy is written, no. But I plan on getting a waiver for people that, you know, we want to document the ones that aren't wearing a mask for some reason. So it could be a waiver, or if it's someone over school age that has trouble breathing, we're not going to say get out of here, or you know.
Well, even that, I mean, you're not supposed to touch your face. Now you got these kids that have masks on. They're constantly going to be touching their face, moving their mask, which makes it worse than if they didn't have a mask.
And
that's not only that, but not listed in here as far as a breathing problem is like so thinking of our staff, if you have a heart condition, now you're breathing in more CO2 than you normally breathe in, and that's a problem for people with heart conditions.
So I'll put that in my waiver, a waiver that I'm going to develop.
And you have a lot of kids that have asthma. I mean, these are just lots of things that I've noticed. And
the nice thing is, yeah, we have to do it, but if people want to sign the waiver and fill it out, they can sign the waiver. So I think that's the only option that we have to allow people not to have to wear the mask.
Okay, and I'm fine with that. I mean, if everybody, I would be trying to find a way myself to sign a waiver to saying I don't need to wear a mask. But as long as we understand the reason for a mask is if I'm sick, I'm not going to get you sick. But wearing a mask does me absolutely no good if somebody else is sick in the room. I'm going to get sick if they're not wearing a mask. The mask is for that. It's for I don't spread it, not so I don't get it.
Oh, I agree. But
that's why I have a real hard time with this.
Oh, I'm right along with you. Unfortunately, I don't know if we have freedom to pass one. So, I mean, it could look different, but
well,
we have
I know,
to do
that's
it.
why I'm asking the question, what happens if we don't pass this?
We just need to pass a policy.
And I realize right now it's just
requiring face masks.
yeah, but why? You know, that's buying into the whole Kool-Aid deal. We're saying, well, we'll play your game and we'll accept this, but we don't believe in it.
You should accept it. School board's there to make policy.
But what is the outcome if we
don't? That's
don't?
my point. That's why I'm asking. What if we don't?
Like when me and Mr. Fields had this discussion, this is recommended by the lawyers that serve the ASBA, so that's what they're recommending. That's not what they're saying you have to do, but that's their recommendation.
Right, and we have had recommendations of policies from the ASBA that as a town, we did not feel were right for our community, and we did not adopt that policy that was recommended by the ASBA. So the question is...
Correct me if I'm wrong, but I think this policy is based off of a law.
Yes. Yep.
So it's based off of a law.
The state.
Yes.
Yeah, mandated by the state.
Because that's what he said in his executive order. The same thing there. We shall.
And the executive order cites the laws too.
Yeah.
There's like 2 separate, but
But there's also discussion on a governor and mayor's rights to dictate that. That's under scrutiny right now as well.
Thankfully, this is just a first reading.
I noticed Mr. Hutchins took his mask off for this discussion.
If you try to talk through one of these things really loud, I did a meeting with my staff with one on. After about 5 minutes, I'm choking and gasping because I don't have the moisture coming in. So you guys can hear me. I gotta.
Mr. Winter.
I'll be quiet.
He had a question, I think. Mr. Winter had a question.
Is there a liability attached to this if you decide you don't want to do it?
That was the question I was asking.
We're not getting an answer.
I don't think the law said, hey, if you don't do this, this is what the consequence is.
That's right. I noticed that.
I don't see attached to recommendation. I see that the lawyers have got together and say that's the way we're going to go. So if you don't.
Okay, so we're not voting on it tonight anyway. It's just a first reading.
It's just a first reading to actually approve it and make it go into our policies. That would be the next time around.
Then part two of that is, in the past, the boys had it on the table for review, but we're going to have these out, so.
Yeah, Kathy, will you do that for us, please? Absolutely. We need to get these out. Yeah, no doubt. And you did pick up on something very important there. So we're hoping that we can deal with this without, making it I mean, we're not even open yet, and we're spending time talking about this, right?
Right.
So we're hoping we can deal with this being a smaller district in a simple, fast way. But if you're asking me, are we going to deny a student enrollment here because of a conflict with this? We're not anticipating, no. That's not part of the policy. You know what I'm saying? So.
Well, and
sorry, go ahead.
You made reference that it wouldn't apply to me. If I come into this building, it's saying it applies to me because it says delivery people and, all kinds of stuff. So even if I just came to do board business, I've got to adhere to it.
Well, that's how it's written. Okay. But anyone, it says it should not be worn by anyone who has trouble breathing.
I don't have trouble breathing.
Well, you said you do if you have a mask on. Right?
Yeah.
Well,
but anyone, I guarantee you check you're much younger than me, and you check your oxygen level wearing a mask, it's going to go down because you're sucking in the wrong thing.
Yeah, good point. We're not planning on checking oxygen levels. If someone tells us, I mean, I don't see us. I mean, none of us, you put your mask back on. Thank you, Mr. Hutchins.
Well, so this is a specific thing that I've had parents ask me about as well, as far as
specifically.
I
would homeschool before I make my kid wear a mask.
And I've heard that a lot as well.
Which is, I mean, that's a parent's choice, and I understand that. And
which is another reason not to open on Monday.
Where I'm trying to go with this is where we're doing a reading of a policy right here. I've actually learned quite a few people listen to these and pay quite a bit of attention to this. So right now, there's probably going, well, if they're going to approve a policy about wearing a mask, my kids aren't going there anymore. So I just want people to understand this is a first reading.
Right.
It's not policy yet. And that's why I'm asking the questions, well, what kind of discipline? There is no discipline attached to this. It just says you're going to do it. Well, they also say that you're going to wear it going to Safeway or into Walmart, but like Walmart, they check when you go in, but nobody watches anybody in the store. And if you don't have it when you're in Safeway, they still do your thing. I realize it's law, but businesses are allowed to deal with it in different ways, and I think schools should be allowed to deal with it in the way that fits their community. That's all I'm trying to say.
Well, and we're here to represent this community, not just our feelings. You and I would assume Dayton as well, has had feedback from the community and the parents and how they feel about it.
Yes, a lot of it. Actually, this has been a hot topic over the last couple of months. Imagine that.
Well, it's good. So, and we brought it up in our virtual town hall. So just to sum it up, yeah, exactly what you said. There's alternatives. exceptions and waivers that are going to be in place for those who have fundamental issues with this
Okay.
regulation.
Okay.
You know,
That's what I wanted to hear. Anything else on any of the other policies? And I realize first reading.
I gotta read it.
Yeah. That's why we have a first reading, so now we can actually go read it and think about it and things like that.
there may be, I mean, it's not beyond the realm of possibility that this is things change by the next time we meet and they recommend that we don't approve this. I mean, you don't know.
And like I said before, we have, it's recommendations from the ASBA that you approve this as a policy, but there have been policies in the past recommended that here at Joe City, as a board member, we've gone, no, we're not doing that one. So, just letting you know. Anything else?
So that was a summary of those.
Yep. Not hearing anything else. So we'll call for the vote, and this is approval of a first reading. Dayton?
Yes.
Rhonda?
Nope.
Okay. Myself,
I
yes.
can't-
but
I
even-
can't
I
agree
get
to
you.
it.
I get you.
Can
So I don't know what happens when we don't approve first reading.
well, it's quorum. Two of the three passed it. So why wouldn't it?
Oh, I thought we had to have 3 of 5.
Only 5 are here.
Oh, okay. Well, I'll say yes.
So just the majority, but there has to be 3 or more, and then it has to be the majority.
Okay. I'll say yes, just because it's a first reading. My vote may change next month.
Okay.
Just
Okay,
let
well,
me
if there's anything specific I can get you guys so we can have the decision made at the board meeting, please let me know. I know some of this might be personal or whatever, but if there's information, data, things I can prepare, just please let me know.
Well, I would like to see there be, I mean, the cloth thing, that bothers me. Because there are a lot of masks out there. There are face masks, there are cloth masks. You know, for us to say you have to use a cloth mask that has to be laundered, you know, whenever people may be buying boxes of 50 paper masks at a time. Is that what the school is going to be providing, is cloth masks? Or are they going to be providing paper masks?
That wasn't in here. I could tell you what we were planning on. But that's not part of the policy, that question. So wherever you want me to take this, but we noticed right away the cloth thing, and that's, I don't know if it's probably not specific in law that it has to be cloth, but for whatever reason, that is how it's come down.
Can you take it to face covering in the policy instead of cloth?
I don't know of any district that has. No, I don't know. That doesn't mean that it's not out there, but I don't know of any that have modified that like this, because they're working with the insurance and all these places. It's probably in the CDC guidelines, the cloth part.
So I remember earlier in the meeting, you said we had masks on hand.
Yeah.
Again, are they cloth?
Yep, we ordered both. I ordered
So
both.
we do have paper as well.
Yeah, the plan was, well, yeah, if that's what they are, they're N95, or those paper masks, what they call paper, N94, whatever. So we have some of both. We were calling them disposable masks, one wear, and then they're supposed to go in the trash. Those were going to be given when and if we open to students that didn't bring their own. So they have the option. Now, we're not going to give reusable masks every day to everybody, just because, you know, that would add up quite quickly. So like staff, if they need school masks, we have enough to offer 1, 2, 3, but these are supposed to be reusable, so we don't want them, you know, wasting stuff, wasting the supplies. Does that answer your question?
Kind of, sort of.
So a kid can bring their own mask. I was, you know, we were thinking that I'm not sure if disposable masks are considered paper. To be frank, I'll have to check and see.
Well, I think it's interesting that they're saying specifically cloth.
I thought that was too when we talked, but yeah, we have cloth masks.
In the mandate from Ducey, from Governor Ducey, he said mask or shield. So
He just said face mask. He didn't give a.
yeah, he said
Face
mask
covering.
or face
Coverings.
shield.
Face covering.
See, face covering needs to be the way it's the verbiage.
So
That's a doozy.
just saying we may want to look into, even though nobody else that you know of is, I mean, we can change a policy and say face covering instead of cloth face
I
mask.
think we can.
I think we can, can't we?
Yeah. So we proceed. Well, so it has been approved. I'll find out, and then at the next meeting, if that change should be made, I will let you know. Since it's not a substantive change in the wording, it may be able to. You don't have to wait another 60 days. So I'll find out and see if we have to wait another 2 meetings for it or not. So I'll get the answer to both of those
Well,
things.
and in all fairness, I mean, I realize this, what Mr. Hutchins is wearing is what's recommended, but I've also seen a lot of people with handkerchiefs. And
Bandanas or whatever.
Yeah.
wrapped around their face. Yep.
and I don't see, I've seen people with cloth where it's loose. Well, one of my problems when I'm shopping is I got to open the bottom of it and get some air up in there. It's still keeping me from putting my germs on people. So, I mean, this is a concern I have.
Well, I'll get those answers for you guys, and that way the board can make a decision if we want to change that title, and not so it's not cloth. I didn't check into that, but I did notice it right away. So
I still don't like it.
Nope.
Ooh, the 8th is after Labor Day. Do we want to do that?
okay.
I try to think of any other information that might be helpful with this, but that's the problem with these things. You don't know what to ask.
Would it be helpful to, at the next meeting, to better understand what can be waived and what exceptions are, et cetera? Maybe we're squibbling over something that by definition can be a waiver or an exception.
The only problem with defining what we will waiver is then we're held to what we define. So I would almost just say being able to do a waiver and allowing our superintendent and principals to say, yeah, that's a waiverable excuse is a lot easier than saying these are the conditions that we allow to be waived, because then we're held to them. So I've found the more leeway we can give, the better.
Well, and if I'm reading this right now, we should all, according to this, we all should be covered. And I have a hard time hearing people with face masks on, because even though I have hearing aids, I read lips.
That's a good point.
And if people aren't facing me and speaking loudly, I can't hear them. And I mean, it's caused me a lot of problems with that. And I'm sure I'm not the only one.
That's one of the concerns some of our staff have shared with me, that the kids can't see their face. If I'm like this, they can't see. We laugh in our administrators' meetings because sometimes we wear this. You can't see if I'm sticking my tongue out at you.
Exactly.
Making a face,
Exactly.
laughing, or I'm being sarcastic, or I'm dang about to get angry.
Well,
the one good thing is you can yawn and you don't have to cover your mouth. That's the only good thing I've found about it.
Like you're saying, some little kids, they're looking for that expression on the teacher's face.
Well, not only that, a lot of little kids learn words and stuff just by, they can see the formation of.
So.
Yeah. Okay. Anyway, we apparently have a lot of issues with this. I do anyway, even though I said yes. So, but this was first reading, so.
And we have to have something in place. So if it's not that, I got to go back to the drawing board. In order to open, I think that was how it was worded. So
in order to, that was something that we definitely need to know come next
it's
time.
on the, yeah.
If
I'll
we
pull
don't
that
have a
down.
policy in place, we cannot open. That's the question.
I
What
think it
happens?
says approved, so like a first reading might be okay. I'll have to check. There are some places that are opening or that have opened, and I don't think they've had a board meeting. Some places are having special board, but you're supposed to have the 2 board meetings, to adopt a policy. This is technically it's a resolution, so even though I think we should wait and treat it just like a policy, resolutions usually don't have the same requirement of waiting. Can be written and enforced by the superintendent alone. It's traditionally how resolutions are.
Well, I think you want the board backing you on this one, so
Yeah.
we'll bring it back around next month.
Okay.
Well, and just a little reminder, we blink every day and we're in a new world. Tomorrow, it may all be gone. Nobody knows. That's just like these numbers that we're having to live by. It is not conducive to fairness at all. And I don't believe, never mind, that's my own personal feelings, never mind.
I'm smiling.
Pardon?
I'm smiling.
Are ya?
Okay, so we're moving on. It doesn't look like there's discussion items. Do we have any requests for future agenda items?
Well, we'll have some, of course, with the things, but the ASBA Law Conference, so you guys decide if you want to participate in that.
Did I miss that somewhere?
Yeah, it's in the upcoming meeting thing.
Where?
Oh, B.
Oh, B. We haven't got there yet, so I haven't missed it. Okay.
Oh, all right. So, but yeah.
So we can.
Agendas where I can.
Huh?
I'll pass out the agendas for those meetings, for that meeting.
Yeah, it's on the link too. It's on the link.
So that'll be coming up next month for us to approve to be on that if we want to.
No, all you gotta do
is no.
All you gotta do is have Kathy register. You decide if you want to attend and let her know.
Just as a member.
Right.
So when do you need to know if we want you to register us?
That was the end of August, I believe.
Okay, so since we're not actually going, we don't have to approve that we can go.
Well, go ahead and sign me up.
Because it's virtual, right?
Because with this last little bit, I really think I need to be going to it.
Yeah, those might be fun meetings.
Right.
Mr. Bushman is welcome to also. In my opinion, it's traditional that someone who's going to be on the board.
I'd say sign me up for it too.
It's
Kathy.
and I didn't go I went one year and it was I was glad I did, but things have happened since then I couldn't go.
This is a law conference in September, not the one in December.
Right.
Right. Okay. Just making sure.
It's, if nothing else, it's interesting just to see what's going on out there.
You're right.
So I don't see a thing on there to approve our next board meeting.
We'll go. Yeah, you can.
Upcoming meetings and events.
Where's that? Oh, right there. Next regular board meeting. September 8th. That could possibly be the first day of school. Or that's the first day football can practice. Huh.
Is it 7th or 8th? 7th.
7th. Could that be the first day of school if the board hasn't met? Oh.
No, I think we, yeah.
Have
I don't
a
know.
special meeting or something.
So when's Labor Day?
The day before the 7th.
It's Monday, right?
Correct.
So that's a holiday. So the 8th
Well, you could
really
you could
is the
start
first day
practice
that
on
you
that day if you want. Or the head coach could start practice on the day if he wants.
Actually, it says after Labor Day. So that wouldn't be till Tuesday.
It gives you the specific dates and it says September 7th.
Okay. Sounds good. So are we good with September 8th?
Yeah, I already got it down.
Okay. September 8th. I'll make a motion that we adjourn.
I second it. Too slow.
Jake?
Yes.
Rhonda?
Yes.
Me, yes. Okay.
We got
Adjourned
stuff to sign.
at 8:36. 8:36.